A visit to the dental clinic isn't something many of us look forward to. But as a reconstructive dentist, Dr. D. Pandurasamy is known for leaving a beaming smile on the face of every one of his patients.
Every new smile that they give after having their work done and the expression of happiness just makes me come back to work the next day.
Dr. D has transformed the smiles of thousands of Australians, but throughout his career, certain patient stories have left a lasting impression.
We've had people who were born with teeth that would be judged by every other person, but it's not their fault. They were born with some congenital problems. And then you see from a road traffic accident where complete normal life could be a silly fault and life changes in a second. And then we have patients from domestic violence who've gone through trauma for no fault of theirs. And when you meet them, you know how much it has affected their life.
These cases motivated Dr. D to launch the Bring Back a Smile Foundation, a charity through which he and his colleagues donate their time, skills and resources to applicants in dire dental need.
My main concerns with my teeth, the way they are now, is there's a lot of discoloration and different shades of colour on my teeth.
Josh Aylett is one of hundreds to apply in the last 12 months.
The gaps in my teeth, I've always been teased and made fun of for them. And I think just about every tooth that I have has something wrong with it, either a hole or a discoloration, or it's been patched up so many times that I don't know how many times it can actually get patched up again.
You can tell there's a lot of early damage that has been happening over time, not in a short frame of time. And you could see the number of times he's been to the dentist with all the patch-ups. It's not like completely neglect, but it's someone who's trying to regain and make things work.
So I grew up in a housing commission for most of my childhood, teenage years. I lived with my mum, my brother and my cousin. My mum always struggled to, I guess, make me feel like I wasn't useless. Nothing I ever did was good enough. And then I would always go to my friends' houses when I was younger and they had two parents, or at the very least one loving parent. And I'd be really jealous, not resentful towards my friends, but jealous that they just had a mum that was so caring and they had a family that did activities and loved each other.
39-year-old Josh says his teeth aren't just a source of embarrassment, they're also an ongoing reminder of his traumatic past.
I was constantly verbally abused about the way I looked, the person I was, the way I behaved, which made me always question myself, which led to being bulimic for about 4 or 5 years, from 14 to about 17, 18. It's led my teeth to have very weak enamel lining, which has made it easier to get decay and chips and damage in general.
How you going?
Oh, good, thanks. How are you?
Yeah, not bad. Would you like a bag today?
I work in a supermarket on the registers, and I guess I try and be extra nice to make up for the fact that my appearance doesn't look as approachable. So I can make people know that I'm not a danger, but I'm not kind of a problem for them. Like, I think that they think that I'm a bad person. I guess it changes the way people look at you in general, because they don't know why your teeth are like that. They don't know that you had problems growing up, or that you know, your teeth were just different, so they judge you. If I'm being completely honest, I feel like the teeth is one of the major obstacles that I'd have to fix to completely change the way I feel about myself and my image.
Josh has been told he's on a short list for the foundation's next giveaway and has been asked to come in for an assessment. What he doesn't know is that he's already been selected as the lucky recipient of a total smile makeover.
Very nervous.
So I've taken all the scans.
Yep.
Right? I've gone through the photos.
Yep.
I've gone through the scans. And I've done a quick design.
Okay.
Okay, but before that, congratulations, you're a winner.
Thank you very much.
Yeah, how do you
Thank
feel?
you. Very good.
Yeah?
Yeah, I can't believe it.
Were you waiting for it for a long time to get something done?
Yeah, definitely, a couple of years.
Yeah.
It took me a few moments to kind of make sure I heard the right thing. I had to keep listening to the rest of the conversation to make sure that I actually heard it right. I'm still shaking.
That's you now. That's my interpretation of what it's going to be. Yeah.
Looking at the pictures side by side and seeing the yellow teeth with holes and the white teeth straight and perfect, kind of looks amazing. Actually, the first thing I thought when I saw it was it looks a bit like a football player. When the football players are on the news, it's just like the perfect white teeth. It feels like you've woken up and you've just won the lotto without really entering it, and then it's amazing that like somebody else is just going to do this for me. And yeah, it kind of changed my whole life. And this time next year, I won't even be thinking about the previous me, and I'll just be happy and not have to worry about what anyone else thinks of me as well. Just live life, relax.